So one time I had this patient come into my office. They had some issues with heaviness of the upper eyelid area, and we talk about kind of what's causing it and what I think will help. And I specifically mentioned that I think a forehead lift is a really important part, lifting that whole area. So sign up for surgery. We get to the surgery day. I get there bright and early because I want to get all the marks on these areas. I walk into the preoperative room and I can just tell something is off. It just doesn't feel right in the room. And the patient looks me in the eye. She's clearly worried about hurting my feelings somehow. And she says, I don't think I want to do the forehead lift. I'm really scared. And that was when I realized that a lot of people are afraid of the big bad forehead lift. It turns out everybody is afraid of the big bad forehead lift. So in this video, I'm going to talk about what a forehead lift really means in the modern era, clear up some of the myths and misconceptions, and I'm going to tell you by the end of the video, if you stay tuned, why I think the forehead lift is one of the most important parts of fixing the upper eyelid area. If you're new to our channel, my name is Dr. Kian Eftekhari. I'm an oculofacial plastic surgeon, and I love talking about eyelid surgery. If you have questions about eyelid surgery, please feel free to leave a comment, and please consider subscribing to our channel. So forehead myth number one, it's gonna leave a big scar. Everybody is worried about the scar with a forehead lift, and that's totally understandable. In the past, I'm talking like 80s, 90s, some people still do it this way. We would make a scar kind of going weaving up above the head and all the way across ear to ear, lift all that tissue up, pull it back, and then put stitches in to kind of tighten everything broadly across the forehead. And you can imagine, by the way I'm exaggerating it, that may not have been the best thing for appearances. Although, to be honest with you, the way we think about what looks good or is aesthetically appealing changes over time. So back in that time, that was kind of the preferred look, is to just pull it back as far as you can. Problem with that approach is huge scars. So I think there is a misconception or a myth that any kind of forehead lift involves that kind of a scar. And honestly, that's very rarely the case in the modern era. So there's different ways to address drooping of the eyebrows, which is really what you're trying to fix with a forehead lift. So in the forehead lift, you're not actually fixing the forehead, you're trying to fix the way the brows appear, because it's very rare that somebody has a wrinkle straight in the middle of the forehead that you're only trying to tighten with a surgery. Usually you can tighten that with Botox, but changing the angulation of the eyebrows, especially the outer half of the eyebrows, is the most important reason why you should consider potentially having a forehead lift as part of a procedure to rejuvenate the eyes, because that is going to dictate how the tissues below the brow actually respond. So it's very rare to make an incision all the way across. Also rare to do something in the center of the forehead that would leave a very noticeable scar, or something above the eyebrow hairs. I sometimes do that, but it's not always the right choice depending on the patient and depending on what kind of scar you want to avoid. For a forehead lift, modern era, most ways that doctors do it is by making a couple of small scars. We're talking 2 to 3 centimeters, so about an inch, maybe a little bit more, and that would be behind the hairline. So not necessarily in the forehead skin, but behind the hairline. The way I do it is I do 2 out here, and sometimes I'll do 2 here. Very, very small, the ones out here. In fact, sometimes I even have a hard time finding the stitches afterwards because the incisions are so small, and trying to get the stitches out, it's just a little tiny area. So misconception to think that a forehead lift is going to involve a big scar. Most of the time, if you're seeing the right type of surgeon in the modern era, it is not going to involve a big scar. It's going to involve very, very small incisions. And that dovetails right into myth number 2. A forehead lift is a major surgery. So this is kind of a difficult one to explain and classify, because what really constitutes a major surgery? Well, generally speaking, anything around the eyes is not necessarily a major surgery from the standpoint of your heart and your lungs, but usually a forehead lift does involve going under anesthesia, and so it's important to understand that it is a surgical procedure. I don't want to minimize that. As far as it being a major surgery, I think people have this misconception that a forehead lift is going to lead to a majorly unnatural outcome, and that makes them think that it's a big surgery. In reality, a forehead lift can be done relatively quickly in experienced hands. We're talking, an hour and a half, something like that, and that can help to just get to these areas and these areas, lift up, release some of these areas around here. The biggest area that we're trying to release with a forehead lift is just those tissues tissues right on the brow bone at the outer half of the brows. And once we get down to that area and kind of have lifted those areas up in a safe manner, we're done. And then we just have to anchor things and lift things out here to give more of that refreshed and rejuvenated appearance. It's not meant to give you a major change in your appearance. It's meant to actually rejuvenate the eyes, make them look more awake without it necessarily being some big exaggerated kind of thing. And that brings us into myth number 3. And this is actually, I think, the most important one that people say. When I speak about people having a forehead lift, the immediate thought that I think most of my patients have is unnatural or plastic appearing or Elvira or Spock or something kind of exaggerated where we're talking about lifting the forehead this high and this high, having a V shape to the forehead where it's kind of going like this. Honestly, that's pretty hard to do. It doesn't happen in many cases that we're trying to achieve that kind of lift. And if we are, I have a conversation with a patient about what our real goals are. What we're trying to do with a forehead lift, from the plastic surgeon standpoint, at least from my standpoint, my opinion, is that we're trying to reestablish the shape of the brow as it goes up and onto the bone and stays high on the bone as it goes across. Sometimes that just means moving the very outer part in the temples. Sometimes it means moving the outer half along with that outer part. And the way I like to talk about it is as if you're like, think about the tail of the brow, the very last part of the brow, as the arrow pointing on a big grandfather clock. And you want to just turn that maybe about a half clock hour or a full clock hour upwards to where it points a little bit higher and at that angulation. You're not trying to lift the forehead. And I think one thing that makes people worried that it's going to be an unnatural appearance is they're worried that it's going to lift the whole forehead. And in fact, that is something that used to be done very frequently with forehead lifting surgery, is that we would go in, cut out the muscles in here to kind of help with some of the wrinkles that happen there. By the way, that's a little risky because there are some blood vessels in there, a couple of nerves that if you nick one of those nerves, you're going to get tingling and numbness and funny shooting pains all up to your scalp, and that sometimes can last a very long time. So when we're doing a forehead lift, we're not necessarily trying to elevate this area, especially you don't want to elevate this area relative to this area, because if this is down and this is up, it just makes somebody look kind of quizzical and odd, like they're just anxious or worried about something when they may actually not be feeling that way. They're certainly conveying that emotion when you have inner foreheads up, outer foreheads down. We want the opposite. We want the inner foreheads to be where they need to be on the bone, and then we want the outer forehead to be a little bit elevated. So unnatural appearances with forehead lifting surgery are rare and not usually intentional in the modern era. We're not trying to create a very zapped up, pulled look. We just want the forehead to look rejuvenated, and we want everything below it to sit normally. And that's where it becomes a discussion of why is a forehead lift an important component of upper eyelid surgery. So if you think about it like a curtain, and you've got the pole at the top of the curtain and the fabric that sits beneath. If the pole at the top of the curtain is curved downwards, or everything is kind of sloping as it goes across, the fabric's just going to be laying on the ground, and it's kind of haphazard to try to pull the skin, because if the bar above it is misshapen, you're not going to get the fabric or the skin below on the eyelid skin to sit exactly where you want. So that's why a forehead lift is so important. We want to get the pole that's holding up the curtain into the right spot, lock that in, and then work on the fabric underneath, which in this case would be the upper eyelid skin, and that's called an upper blepharoplasty. Usually those two procedures go together, where we do a forehead lift and an upper blepharoplasty at the same time, because we want to work on getting everything to look rejuvenated and up high, and not necessarily having a big sloping downwards of the skin or the temple area. Because if you just remove the skin, but you don't address up here, it's still going to look kind of a little bit downwards and maybe not give you the aesthetic appearance that you're looking for. So those are the 3 myths with a forehead lift as I see them. And a lot of my patients are afraid of forehead lifts. Hopefully, by watching this video, you have some understanding of why those myths are misconceptions, and also what you might be able to ask your surgeon about if you're thinking about a forehead lift or having a consultation about it. If you'd like to learn more about eyelid surgery, please consider watching more of our videos or subscribing to our channel, or just leave a comment below. Let me know what you'd like to see, and I'm happy to talk more about it. I love talking about forehead lifts. It's one of my favorite surgeries to perform, and I really think it's important as part of upper eyelid rejuvenation, but it's very hard to explain why.